I'd like the honor to present the results of the Australian National Joint Registry, a 10-year follow-up of over 60,000 replacements. I'd like to thank my co-authors for helping me put this presentation together and this paper together. None of the disclosures are valid for this presentation. So the Australian Joint Registry has roughly 1.5 million primary and revision procedures. It started in 1999 with the hip and knee data. And since 2008, we've had shoulders incorporated. Essentially, we have 100% data capture on every single joint replacement done in Australia. It is mandatory surgeon participation. Each orthopedic surgeon puts a bit of annual registration fee into it. Australian Orthopedic Association co-funds it, and there's a significant amount of funding by the State Department or the Federal Health Department. The registry is housed in South Australia in this magnificent building. There's no industry funding whatsoever for the registry. The end goal of our registry is time to revision. If we look at the registry at 10 years, hip replacement has a 6.6% revision rate, and a total knee for osteoarthritis has a 5.3% revision rate. So if we compare this with a reverse is almost similar to a total hip replacement, which is considered the benchmark orthopedic operation. A total shoulder is sitting at 10%, and a hemiarthroplasty is a bit higher than that. So in the last few years, the number of shoulder replacements has exponentially increased, and predominantly the vast majority of them are reverses and total shoulder replacements. This is what a standard registry form looks like. It's all completed by hand. The stickers of the implants are put onto it, and this is sent to the registry. We only have 2/3 of the patients who have CT scans performed for the pre-morbid anatomy evaluation, as this started only a few years ago. So let's look at the results of hemiarthroplasty. The rate of hemiarthroplasty has significantly plummeted, and basically it's only used for fracture now, and in some cases it's used for osteoarthritis. The resurfacing has a revision rate of 17% versus a stemmed hemi, which is a revision rate of 12%. If we look at the 10-year data here for fracture or osteoarthritis, much to my surprise, the revision rate of a hemiarthroplasty, a stemmed hemiarthroplasty, is the same at 10 years, whether this is done for a fracture or a post-traumatic osteoarthritis. Pyrocarbon is an implant which is used in Australia as a hemiarthroplasty, and it has a 5-year revision rate of around 6%. Which is interesting to note, and this is lower than some of the other hemi replacements which are performed with metal heads, so there's something to keep a watchful eye on. Cemented fixation for fracture has a lower rate than revision than when an uncemented stem is used, and this is statistically significant. Thus, a hemi has a 12% revision rate at 10 years, and a cemented stem for a fracture does better than an uncemented stem. Now, if we look at the total shoulder replacements, the number of total shoulder replacements has conventional shoulder replacements has plummeted as the reverses keep climbing. But if we look at the percentage revision rate for a total shoulder replacement, it's 12%. If we exclude the SMRL2, which is a higher than normal revision rate in the Australian registry, the revision rate for a total shoulder replacement is 9.9% at 10 years, compared to 6.6% for a reverse shoulder arthroplasty. A stemless shoulder replacement is gaining popularity as in most parts of the world. At 5 years, we don't have long-term data, but the 5-year revision rate is only 5%, which is very good. The majority of the implants used in Australia are Matthys and Simplicity, and we have only 1,600 stemless total shoulder replacements. The number one cause for revision for these are instability and dislocation, which could be predominantly because of subscap failure. We have around 13,000 total stemmed total shoulder replacements. But as you can see that the all cementless, which is the blue line, which is cementless stem and cementless or a metal bag base plate has plummeted in Australia, and a hybrid where there's an all polyethylene cemented glenoid is increasing with an uncemented stem. This is because of a significantly high revision rate shown in the Australian registry with a metal bag glenoid. So if we look at the various causes for a revision, surprisingly, osteonecrosis does not have a significantly increased rate of revision compared to osteoarthritis or rheumatoid arthritis. Clearly, metal bag and hybrid glenoids have significantly higher revision rate compared to an uncemented glenoid. Compared to a cemented glenoid, 8.4% versus 24%. So the cementless metal bag glenoids have a 3 times higher revision rate than a standard cemented all poly glenoid. Does the type of poly make a difference? Our registry has initially shown that a crosslink poly does have a lower revision rate than a standard non-crosslink poly. The humeral head or the humeral stem has had no bearing on the revision rate in the Australian Joint Registry. So the 7-year results in a young patient who's under 65, our registry shows that a reverse shoulder replacement in a young patient under 65, a reverse still outperforms all the other modalities of fixation in this under 65-year-old group. So for a TSA, we have a scan in only 60% of patients. A stemmed hemi revision has a 12% revision rate. Pyrocarbon has early promising results with 6% at 5 years compared to 7.7% with the total shoulder. So it's just marginally better. In a fracture, a cemented stem does better. Crosslink polyethylene does better. And all polys do better. Coming to the reverse shoulder replacement. In Australia, there's around 25,000 reverse shoulder replacements, which is done for all comers, and clearly there is a reversomania. The most common implant is a cementless reverse shoulder replacement. 60% of the designs used in Australia are the Grammont design, and it's so basically important to understand that the results which are reflected on the Australian Joint Registry will be skewed towards a 155 design. We have a cumulative revision rate of 6.6% at 10 years for all comers, with all surgeons of different skill set performing this operation. And there is no difference of this whether it be for osteoarthritis, cuff arthropathy, or fracture. In an interesting paper which was published by some of my colleagues, which have shown that majority of the surgeons in Australia, which is 80%, are doing less than 10 cases each year. And only 2% of surgeons are doing more than 4 cases a year. And this is shown in the revision rate, where surgeons who do less than 10 cases per year have a slightly increased rate of revision, which is in the first 3 months, which is predominantly related to instability and dislocation. So this cumulative revision rate, which is high, is in the first 3 months, which is reflected in our registry. Fracture RSA also has a higher revision rate within the first 3 months, and this plateaus over time. The number one cause for revision in the Australian registry is instability, followed by infection, followed by loosening, and followed by periprosthetic fracture. These are the 4 most common causes of revision of a reverse shoulder replacement. Is glenoid the biggest problem in a reverse like it is in a total shoulder? 41% of revisions of a reverse shoulder replacement are actually related to the humerus. So the glenoid, as long as it's well fixed and we've been able to attend to the glenoid defects, is not the biggest problem in a reverse shoulder replacement. The biggest problem is actually the humerus. Age has, if you're over 75, your revision rate is lower, but this is only marginally lower compared to someone who's under 65 years of age, which is the blue line, where you can see that the revision rate is slightly higher, but it's sitting at 7.5%. Cuff tear arthropathy has no difference at revision rate if reverse shoulder replacement is done for a rotator cuff failure. So this is really important. If someone comes to us at the age of 55 with a large retracted rotator cuff tear, and you're thinking whether or not you want to do a reverse shoulder replacement on him, the outcome is actually same if this patient was above 75 years of age. Cementing does better, but it especially does better if you've got a fracture. A smaller glenosphere size is an independent risk factor for a higher revision rate, and the Australian Joint Registry shows this, that if you've got a glenosphere less than 38 millimeters in size, you have a higher revision rate. Now, when we come to a fracture, there is clear evidence in our registry which shows that a cemented humerus has half the revision rate, 3.5%, which is the blue line, compared to a cementless humerus which is used, which is 7%. Which makes sense because I think there is some stress shielding which occurs here, and then if the tuberosities don't heal, you have dislocation which relates to a revision rate. Thus, to summarize, the Australian Registry for a reverse shoulder replacement shows an over 93% survival at 10 years. If you're under 65, you still have a 92% chance of survival. Larger glenospheres have a lower revision rate. There's insufficient follow-up in fractures as yet, but clearly the cemented stems for fracture have a 3 times lower revision rate than an uncemented stem. Thank you so much.